Hello, my name is Shawn Gallagher, and today we're going to be talking about breathing in the process of preparing for birth. This is one of 3 pieces that is covering this topic. This one will be basic breathing, then we'll be diving into more detail on specific breathing for birth, and then another one on just some more advanced strategies on the whole topic. So today, this particular presentation will be just doing a very quick review of the phases of birth, just to refresh your mind. Quick overview of how breathing works and the best way to breathe in general. Just a very little bit about babies and their breathing process. Small bit of information about 2 major leaders in the field of childbirth and their theory about breathing. A little bit about relaxation. And then what the research shows us from the United States and Canada on the topic of non-pharmacologic pain management, what works and what doesn't. So let's get started. Just to review the parts of birth that when people study birth, we break it into these key areas: early labor, active labor, pushing, and the birth of the baby, and then the birth of the placenta. So as we just take a very quick look at early labor, active labor, and pushing. Early labor, the contractions are 5 minutes apart or more, so they might be 6 minutes apart, 10 minutes apart, but generally 5 minutes apart. And in childbirth preparation, they talk about the 5-1-1 rule. So contractions are every 5 minutes, lasting a minute for an hour. Not uncommon for women to be told to contact their care provider or go into the hospital with 5-1-1. This is where the cervix is thinning. It's unusual to get any significant opening, especially for a first baby. And for first babies, this can be quite a lengthy process, on average 20-24 hours. Of course, for some women, it's going to be quite a bit shorter. For some women, quite a bit longer. Contractions are mild. Active labor is the part of birth that you're expected to be in contact with your midwife or your physician. This is usually when the midwife will attend you, so either in your home or ask you to meet her in the birth center or the hospital. For people who have a physician, then you will be going to the hospital definitely by this point. So 3 contractions in a 10-minute window are what is considered active labor. So generally every 2 to 4 minutes, roughly every 3 minutes on average. And this is when the cervix dilates. On average, this part of the birth takes 12 hours for first baby, second and subsequent babies 8 hours. And then once the cervix is completely open, then pushing happens. The contractions can be close. They can be every 3 minutes or so, but not uncommon for them to be further apart every 5 minutes or so. For first baby, average length of pushing can be about 2 hours. Second babies, an hour, or about half of what it was for the first baby. And this is when the baby is moving down and baby is born. Then, of course, the birth of the placenta happens after that point. So as we move to just what to do in the different parts of the birth, general recommendation for early labor, unless you've been told otherwise by their healthcare provider, is to ignore it, get your sleep, make sure you're eating and replenishing fluids and so on. Active labor is the part of the birth that we're looking at strategies for coping and finding greater comfort. So with early labor, generally, we're not really thinking in terms of using any particular strategies for breathing. It's in active labor that we'd be looking at what you might do in regards to breathing to help you through this part. And if somebody's wanting an epidural for pain management, this is the part of the birth that an epidural for mother's request will be happening. And depending on where you're having your baby, most places require a minimum of 4 centimeters dilation. Some places are saying 6 centimeters. Again, talk to your care provider about that. The kind of breathing that's used for pushing is going to be different than the other parts of the birth. And in general, the intensity and the space between the contractions are different. So the intensity drops in pushing and you get longer rest periods. For most women, pushing is pleasant. There's relief and it feels much better. Of course, around those minutes, it's a very short period where the baby's head is crowning. It's very intense, but it's over with pretty quickly. And to know that if you're pushing for an entire hour and the contractions are every 5 minutes, you're working for 12 minutes. You're not pushing for that entire hour. You only push during the push in general. So for early labor, you would just want breathing that would be calming to you. You're wanting to breathe into your belly, and we'll talk about why that's important. Some people do find it helpful to focus on a longer exhale. That just helps calm the nervous system, helps the parasympathetic rest and digest nervous system come online. And in general, we're always recommending that you're breathing through the nose, so in through the nose, out through the nose. Ideally, you're doing this calming breathing throughout the entire birth. But it's not uncommon in active labor with strong contractions that our breathing tends to shift, tends to be a bit more active and rapid, maybe more breathing into the chest, more mouth breathing. So if that's happening in the middle part of the contraction, so contractions last roughly about a minute, so you're talking about the middle 20 seconds of that minute. If the breathing is a bit more rapid, not that big a deal. What you want to do is you want to slow it down when the contraction's over and to use the rest period to help you with that. Sometimes it can be helpful for the partner to remind you roughly 40 seconds into that contraction or at the end of the contraction to slow your breathing down, kind of let it go. So the kind of breathing that might sound a bit more active during this part of the birth in the middle part of the contraction sometimes sounds a bit like so just a kind of a rapid breathing, sometimes in through the nose, out through the mouth, so that if you're finding that kind of breathing is helpful to you, it's getting you through the contraction is not a problem, just to slow your breathing down when the contraction is over. In the next presentation on breathing, we'll talk about the different types of breathing for pushing. And pushing is a part of childbirth that we're seeing still some very old-fashioned ways of approaching this process. Essentially, directed pushing is where the nurse or the care provider is telling women how to push, how to breathe for that push, and more of the modern current thinking on that is to allow women to kind of find their own best way to do that. So just that awareness that we'll be covering that later. For now, if you want to just take a moment and put your hand on your belly, one hand on your belly, one hand on your chest. Drop your shoulders so that your shoulders are kind of relaxed. Sometimes when we're feeling a bit more tense, our shoulders will tighten up. Sometimes when people focus on breathing, they try to breathe with their shoulders, and we don't need our shoulders to help us breathe. So relax your shoulders, relax your jaw as well. And we're going to just take a minute and I'll tell you when to start this process when the minute is over. If you want to just count your breath, so every inhale and exhale is one breath. Ideally breathing in through your nose, out through your nose, and there's no right or wrong with any of this. If you just want to get a baseline of what your breathing is for you. So just take a minute now. So starting now, just start counting your breaths in and out. Great. So that's about a minute. So if you have an idea of how many breaths is just normal for you sitting here. For some people, 6 breaths a minute is normal. For some people, 20. Of course, we tend to be breathing a little bit more in pregnancy. And the further we get to the due date, the higher up the belly is, the harder it can be sometimes to breathe because there's just not as much space. So just kind of having an idea of what's normal for you. Then moving on, just some of the facts around breathing, that on average many of us are breathing roughly 15,000 breaths a day. So that's important to know that our body is doing that important work. And the lungs actually need help to breathe. They don't have a way of doing that themselves. So the diaphragm, the muscles between the ribs, and the abdominal muscles are what is part of that process of us taking a breath. Now the diaphragm is actually 2 muscles that contract and relax. And when we breathe in, it's the diaphragm contracting, moving down, which is why the belly comes out, allows greater space for the lungs to have breath, air move into the base of the lungs, and then the diaphragm relaxes and we allow that exhale. When we think in terms of getting more oxygen into the body, a lot of people will say, well, in order to get more oxygen, just take some deep breaths. But we know that if you've ever seen anybody have an oxygen saturation monitor on the end of the finger, our oxygen saturation in the blood is close to 100%. It's usually well over 95%. So what that means is that there's an oxygen molecule bound with hemoglobin and the red blood cells in the blood, and so the red blood cells are carrying quite a lot of oxygen throughout the body. When we look at how oxygen is utilized in the body, again, I'm not an expert in this area, but just some of the research I've done, the oxygen molecule in the red blood cell can actually just keep circulating with that red blood cell through the body and doing its loop with the circulation throughout the body. When the tissue needs oxygen, the red blood cell needs to release the oxygen and then pick up carbon dioxide. And it's not low oxygen in the body that triggers us to breathe, it's actually high carbon dioxide. So carbon dioxide is the gas that is the signal to the body that we need to breathe, and it's also the signal that allows the hemoglobin to release the oxygen into the tissue. So somebody could theoretically have high oxygen saturation in the blood, but not very good at oxygenation to the tissue. And so it's really important that the oxygen get from the blood into the tissue. and we'll be talking about that a little bit later. Now, the lungs are structured so that the upper part of the lungs, closer to our collarbones, are narrower, smaller. The base of the lungs, closer to the diaphragm, are bigger. So we can actually take in more breath, more air, more oxygen into the base of the lungs, which is one of the reasons why it's important to breathe into your belly, have breathing that's deeper into the lungs. The lower part of the lungs are more productive in terms of utilizing oxygen. One of the terms used in respiration is called tidal volume, and that's the amount of air that we take in with one breath. A healthy person will take in about 500 milliliters of air, and if that person's doing 12 breaths in a minute, that's roughly 6,000 milliliters of air in 1 minute. People who are unwell are actually taking in high levels of air. Because newborns are small, their lungs are small, their respiration is more rapid than ours is, but they're not taking in as much because of the size of the lungs. And just to know that oxygen is an oxidant, it'll rust metal. Our bodies need oxygen, of course, but our bodies are in this kind of balancing act in terms of something that it needs, but trying to mitigate the negative effects that oxygen can have within our system. Breathing through the nose is very important. It allows the air to be moisturized, humidified, filtered. It helps slow the breathing down. And in the nasal cavity, the capacity for the body to allow nitric oxide, which is very important, it mixes with the air that we're breathing in, and that goes into the lungs. The lungs don't do well with very dry air coming into them, and that process of breathing in through the nose is really very important for the lungs. We also have higher oxygenation when we breathe through our nose. Now, the diaphragm is actually two muscles. One helps with respiratory function, focuses more on respiratory function, and the other is more for gastrointestinal processes. With belly breathing, it helps the lungs to bring air into the base of the lungs. Hiccups, of course, are what happens when the diaphragm is in spasm. And if you're just kind of reading and they're talking about thoracic breathing is just another word for chest breathing. Humans and other mammals are the only vertebrate species that have a diaphragm. And the theory is that the diaphragmatic muscles are part of what helped in the process of evolution to facilitate oxygenation of our brains. So just a bit of a diagram here on the lungs and the diaphragm. You probably have seen this before, but with breathing in on the left side, the diaphragm has come down lower. It allows for the lungs to expand. With the exhale, they rest back to the normal position. So all of us at birth breathe from our abdomens, and in fact, if when a baby is born, that baby is not breathing abdominally, then that's actually a problem. Abdominal breathing or belly breathing is quite calming to our nervous system. The parasympathetic or PNS nervous system is the rest and digest. And whenever the parasympathetic nervous system is dominant, it's a powerful reminder that we are safe. Abdominal breathing helps the lymphatic system work more effectively. The lymphatic system does not have a pump, so exercise and breathing is how the lymph moves through our body, and that helps with removing toxins. The breathing into the base of the lungs, and often you hear people talk about taking a big breath or a deep breath. So a deep breath in our work here means breathing into the base of the lungs. It doesn't mean a lot of breath. So you want to breathe into the base of the lungs, but you're not wanting to force your lungs to take in too much air. That's not good for the lungs in general. And the nice thing about breathing into the base of the lungs is that you can do it anywhere, anytime. It can just take a few minutes. You can just be waiting on hold at a red light and just kind of check in with your breathing and just make sure you're breathing into your lungs. So we did a bit of breathing before, and maybe you noticed which hand was raising a little higher than the other. In general, when you're doing abdominal breathing, the hand on the belly should be the one that raises, and the hand on the chest should be fairly still. So breathing in through your nose, out through your nose, dropping your shoulders, and focusing on breathing into the hand that is on your belly. You might find it helpful to imagine the breath all the way down into your baby or into your pelvis, maybe even into your feet. And then just allowing that breath to release and let go on the exhale. So as you take these moments to allow a couple of deeper breaths, that can be nice to just let your nervous system feel a little better. Moving on, all babies breathe abdominally, as mentioned previously. A lot of researchers have found that by grade school, the majority of kids are chest breathers. So really important when our kids are born that we help them facilitate that process of continuing to breathe into the base of the lungs. Before birth, babies will practice breathing. The lungs actually take in amniotic fluid and release it, so we've seen that on ultrasound where the breathing movements are part of what babies are doing all the time, and that's normal. Babies can also smell and taste prior to birth. So generally, any foods that you've had to eat that might have more of a smell like garlic or spices and so on, a little bit gets into the amniotic fluid. And because amniotic fluid is going into the baby's nose past the scent receptors, your baby's smelling that. And then babies are swallowing amniotic fluid as well in utero, and so they'll be also tasting some of the foods that are normal for you and for your culture. One of the theories around why we think children will shift to chest breathing and why people breathe primarily in the chest is due to emotions. So that when we're stressed, when we're upset, we tend to shift our breathing naturally into the chest. And we know that when we're upset, just breathing into the belly can actually help us feel a little bit better. Grantley Dick Reed published a book in 1944. He's a British obstetrician, Childbirth Without Fear. His theory that fear, tension, pain is a cycle, and that if we can provide some information that helps people be not as frightened, that if we can do that, that would eliminate fear, and therefore that would eliminate pain. Interesting theory, and it's part of how some childbirth preparation is focused on. We know that fear can certainly enhance pain, but that theory that pain is only the result of fear isn't something I think many people would ascribe to. Grantley Dick Reed's proposal was sleep breathing, and what he suggested that longer exhales as compared to inhales would be helpful for childbirth preparation. And we know today that longer exhales are helping the parasympathetic nervous system be more accessible, be more online. When we breathe in, the sympathetic nervous system is stimulated. When we breathe out, the parasympathetic is stimulated. The sympathetic is the fight or flight. The parasympathetic is the rest and digest. So if you're looking for some ways to just help yourself calm down a little bit, then the ability to just have a couple of slower, deeper breaths can be helpful. Fernand Lamaze was a French obstetrician. He published his book, Painless Childbirth, the Lamaze Method, in 1956. And the Lamaze Method is well known for shallow, rapid, rhythmic breathing. So chest breathing, high up. In his book, he says to breathe in and out through the nose or in and out through the mouth. He also recommends, as I believe Grantley Dick Reed did, what's called a cleansing breath. And a cleansing breath is just a slow, deep breath. But the idea that you're doing a cleansing breath at the beginning of a contraction and a cleansing breath at the end of a contraction, just to mark the beginning and the end. Psychologically, that can sometimes be helpful. Dr. Lamaze said that the breathing should be silent, but what's been known to be Lamaze breathing tends to sound like he hoo or ha 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 hoo, so a bunch of shorter breaths to a longer breath. Even Lamaze classes today don't teach that anymore because it's just not helpful. So Lamaze breathing is also known as pattern breathing. In general, they're recommending 6 to 9 breaths per minute, which I'm not quite sure how that works with the he hoo hoo ha ha thing. There's a lot of kind of confusion as to what Lamaze breathing is from what I've seen going back to the original work and what's been taught over the years. Lamaze went to the Soviet Union in 1951 and was studying what they were teaching there. But in general, the Lamaze method is hyperventilating, and that's not a good thing for childbirth. Lamaze called his method psychoprophylaxis, which is what the Soviets were using as a term as well. And so there is some research on psychoprophylaxis and why we think that that can be helpful. And then some of the other leaders in the field in terms of relaxation, Jacobson, American physician back in the 1920s, 30s, and so on, he came up with this idea of progressive relaxation, so sequentially moving through the parts of the body. And in Jacobson's method, you would tighten up that part of the body and then relax it. And for some people, that can be very helpful because tightening up that muscle group actually gives them a pretty good awareness of just how tense they are. So today we talk about residual muscle tension. So some of us will often hold quite a lot of tension in some parts of our bodies that just feels normal to us. But once we get an idea of what that's really all about, then it makes it easier for us to kind of focus on relaxing that part of our body. Dr. Herbert Benson published a book called The Relaxation Response, and he was one of the first people getting involved in kind of the mind-body stuff in medicine in the United States. That idea of just kind of helping the body relax as a way of helping the mind to be more relaxed, feeling better, and bringing down levels of anxiety. Now, the research in the United States, we have the latest survey, the Listening to Mother survey done in 2013, asked 2,400 women who had given birth to just fill out an online survey about how things went with their birth. Quite a fair number of them, almost half, said that they used breathing strategies for birth. Position changes, hands-on strategies, mental strategies were also what they talked about, but not many used some of those. So in this slide, we'll just see kind of a graphic representation. So breathing techniques quite high in terms of drug-free ways of helping get through the birth. But then what we also see is a fairly high uptake of epidural use in the United States, so 67%. So the majority of births utilize an epidural. And of course, there are women who can have just an epidural or just narcotics, or women who can actually have both. Nitrous oxide and so on. So you can have births where there's a range of different medications being provided. And what we're finding is that certainly epidural use is reported as being very helpful overall. Narcotic use, somewhat helpful, not something that most people would want to use a second time. But in general, breathing methods, not that helpful. So as we move to the Canadian research, the last survey that was done throughout Canada was published in 2009 and looked at births that happened between 2005 and 2006. A much higher incidence of women saying that they use breathing methods. And as we look at this chart here, just kind of graphically what's shown is as what was used. And again, breathing, not that helpful. In fact, bath or shower, much more helpful for women. As we understand that very few women actually have access to water or what's called hydrotherapy in birth, it's a shame that it isn't more available, because if more than half the women are saying that they're finding water to be particularly helpful for pain relief, we should be providing that, I think, in much more significant ways. The epidural rate in Canada for this particular survey, lower than what was shown in the States. We know that the research in the southern Ontario region, certainly the Greater Toronto area, the epidural rate is roughly 70-75%. In most of the major hospitals in Toronto, it's even higher. It's well over 90%. Some of the hospitals, 95%. So fairly high epidural use in the majority of hospitals. And if you're looking for information yourself, this is available all online. So that as we look at what women actually find helpful for birth, epidural certainly very helpful. Baths or showers, very helpful. Breathing, not very helpful. So it may well be that there's different strategies for breathing that are going to be more helpful than others. That isn't really looked at very closely in the research. And I don't know that the research really specifies the different types of breathing, whether it's Lamaze or Grantley-Decreed or some other way of doing that. But what I would like you to come away with is it's very important to always be breathing in through the nose, out through the nose. And as you can just start getting into that habit now of making sure that you're not breathing using your mouth, so keeping your mouth closed, breathing in through the nose, out through the nose, and as best as you can when you're focusing on breathing, to bring your focus to your belly so that you're retraining your body to breathe into your belly. Hyperventilation, never helpful. And some of the current thinking with pain management is our bodies will be in pain if the tissue is not being well oxygenated. So allowing abdominal breathing, breathing in and out through your nose, is going to be your most important first steps in that way. So thank you for sitting through this presentation. I hope you found it helpful. If you want any more information, ShawnGallagher.com, or 416-255-8333. I welcome comments, feedback. I look forward to hearing from you. And moving on to the next slide, we'll be providing some more information that's helpful for actual birth.